Hello, I'm Dr. Willis. I've been practicing as an aesthetic medical doctor for more than 15 years. I was invited to come here to talk about what I do best, which is helping people to look good. When patients first make contact by phone or by walking into your clinic for the first time, they might feel anxious and uncomfortable due to the unfamiliar environment and people they come to encounter. Make sure your voice is friendly and sincere.
Hello, welcome to Perfect Skin. Can I help you? My name is Yvonne.
Hi, my name's Rachel. Well, my skin seems to look dry and not as radiant as it used to, and I seem to look more mature than my actual age. A friend recommended me to come to your clinic for some treatments. I'd like to hear from some experts on what I should do.
Okay, I see. Aging is a natural process. It causes skin dehydration, volume loss, and the appearance of wrinkles. Yes, there are plenty of treatments available. To find out the best solution for you, we need to examine your facial volume and skin condition first.
Also, you can help reduce the anxiety by helping them get mentally prepared at the appointment stage. You can tell them who they will meet, expected duration of the consultation session, and any consultation charges if there are any.
Would you have time to come over for our beauty consultant and doctor to take a good look? The first consultation is usually around 30 minutes, also depending on how many questions you have. Yes, and it's totally free of charge.
Assure patients that they do not need to commit to any treatments on their first visit.
You don't have to make any commitments immediately. Just come and meet our doctor first. I'm sure he will give you some professional advice to meet your needs. So when is a good time for you to come over? Do you know how to get here?
Yes, I know how to get to you. I'm actually available next Tuesday afternoon.
How about 2 p.m?
Sounds good?
Do you have any further questions?
No, that's it.
That's great. So let me just confirm again. Your appointment is scheduled for next Tuesday, June 16 at 2 p.m. We look forward to seeing you then. Thank you for calling. Goodbye, Rachel.
Bye.
Approach your patients with friendly smiles and good eye contact.
Hello, welcome to Perfect Skin. Can I help you?
Hello, I'm here for my consultation session at 2 p.m. My name is Rachel White.
Yes. I've been expecting you. My name is Yvonne, and we spoke on the phone. How's your day been today, Rachel?
Great, thanks.
Then offer something to drink and provide magazines and brochures for patients to read while they wait.
It's really cold today, isn't it? Would you like something to drink?
Yes, a glass of water, please.
Tell patients what you will do with them.
First, I'd like to ask you a bit more about yourself, your medical history, and what your expectations are. This should take approximately 15 minutes. Then you'll meet with Dr. Willis, and he'll analyze your facial features and give you some professional opinions on your personal treatment plan. Then afterwards, I'll meet with you again just to wrap things up.
And give them some background information about your clinic or the doctor.
Dr. Willis is our most professional and experienced doctor here. He's been practicing for over 15 years.
A well-designed questionnaire can help collect a handful of useful information in a short period of time. The consultant can use the questionnaire from the Galderma Harmony program and go through the questions with the patient systematically. This will make sure nothing important has been missed out.
Have you seen any of the following practitioners about your appearance? Dermatologist, psychological counsellor, a surgeon or a cosmetic dentist, or any others?
I haven't had any aesthetic procedures before, but I have visited an aesthetic doctor about 6 months ago. They recommended I should do some kind of heat treatment. It sounded very dangerous and I couldn't understand how it works. They were very pushy and it was very expensive anyway, so I didn't sign up for anything.
To gain the trust of your patients, you need to go beyond asking simple questions and understand them in a holistic way. When you provide feedback, you can show that you understand them by paraphrasing their statements. When you probe deeper, you will be able to find out patients' actual motivations, budgets and objectives. This information is very important for you and your doctor to create a suitable treatment plan for the patients and greatly increase the chance of commitment of the patients.
Oh, I see. Well, to ensure your comfort, we'd like to ask if you're anxious about any parts of this consultation. For example, are you worried about the side effects, pain, dissatisfaction with results, or the anesthesia?
In fact, I'm most worried about the pain.
I understand. Before treatment, a nurse will apply anesthetic cream, so you'll feel numb rather than pain. But I'll just make a note of the fact that you're a little worried about the pain. Is there anything else?
That's basically it. My friend told me that Dr. Willis is a very experienced and professional doctor, so I'm not worried about the results.
He sure is. Just now you mentioned that you refused treatment last time. What triggered you to come in this time?
Oh yes, I will attend my younger brother's wedding in 4 months. I would like to look my best by then.
Congratulations! That means you wish to see some visible results. We do have some solutions that provide noticeable changes within a few weeks after a few treatments. So do you want to look completely different or just slightly younger and more refreshed?
I would be happy if I could look about 5 years younger, but I don't want any drastic changes.
You can show empathy by sharing stories about cases similar to them. Patients like to hear real and compelling success stories that they can relate to. Once patients feel that you can be trusted, they will be willing to share their stories with you.
Let me share with you a case of another patient I know, a 35-year-old lady who came in to see us about her thin lips and skin problems just before her best friend's wedding. She wasn't very confident when she first came in, but after a few treatments of filler injections, she was not only prettier, but she was more confident and more cheerful too. She was really surprised that just some small changes could make such a big difference.
Empathy only works when it is genuine and natural. Show patients that you understand what they're going through, and you will try your best to help them fix it.
I know how you feel. It's really frustrating when people say things like that, isn't it? What we do here isn't just about removing lines and wrinkles. It's also about making you feel better about yourself. People often ask, how do you justify beauty treatment costs? I would tell them to ask themselves this question: do you want to look younger? Because beauty treatment is a want. And if you want something, you'll give yourself permission to do it. And there are so many options at different costs. If you could give us an indication of how much you'd be willing to spend, then we can match your expectations with our solutions. Have you thought about what you'd be comfortable in spending?
My friend said she spent about 1,700 euros on her treatment. I think that sounds reasonable to me.
Each patient may have one area that he or she is most concerned of. This patient is concerned about aging and skin quality, but the consultant did not just focus on skin quality and aging. Instead, she also examines other areas of the face, using her knowledge and personal experience.
When you made this appointment, you did mention that you wanted to improve your signs of aging and your overall skin appearance. Is there anything else?
Those are basically my key concerns. I want to have a more refreshed look on my face.
Okay, let's see. You did say you're a flight attendant, is that correct?
Yes, I've been a flight attendant for almost 8 years now.
Frequent air travel will dehydrate your skin. Every time I go on a flight, my skin is really dry too. There are 3 places that are the focal areas: the eyes, the nose, and the mouth. The reason why people think you look old and tired is because of the eyes and the corners of the mouth. When we look at somebody, we usually look at the eyes first. When we start to get older, our face will lose volume, sag, and that will be the start of lines and wrinkles. This results in a really tired and sad appearance.
Analogy is a great way to make abstract and complicated concepts understandable.
Obviously, we have some choice on what we can do first, based on your situation and needs. I think hyaluronic acid fillers should be able to solve your key problems. Hyaluronic acid acts like a sponge that absorbs and retains water 1,000 times its weight. It helps to hydrate our skin and improves facial volume and overall appearance. I'd like you to now speak with Dr. Willis, and he'll be able to give you some professional advice from a medical point of view.
The beauty consultant should identify patients' needs and debrief the doctor about patient's background, expectations, objectives, affordability, and motivations. So, let's start with your most concerned part, skin aging and dehydration. Before I start, let me tell you a bit more about what happens when we age. Alright? During the analysis, you may need to educate patients about their skin structure, facial anatomy, or biological process related to the treatment. In the process of discussion, you may bring up some technical terms. Do not assume your audience will understand you. Patients may be afraid to ask what you mean or to ask you to clarify yourself. People will not buy what they cannot comprehend. If you have used special terminologies, make sure your patients really understand what you are saying. So, the aging of the skin, deep fat pads, as well as bone all play an important role when it comes to facial aging. A youthful appearance very much depends on having the right amount of fat in the right areas of the face. And as you grow older, you lose these volumes of fat and bone. Together with the loss of skin elasticity, a sagging facial appearance will be seen, making people look older. You know, like a V triangle being turned upside down. Doctors who are able to conduct a comprehensive facial analysis are more likely to gain the respect and trust from patients than those who are not. Make use of the global ranking scale from the Galderma Harmony program to conduct the assessment. The visual presentation in the assessment form is an easy way to help the doctor document and patients understand their problems at a glance. It will help patients realize the severity of their problems and logically prioritize what to do next. If patients can follow the analysis, it will be easier for them to agree to the doctor's treatment solutions. I will use this scale to evaluate your situation. I will be evaluating many criteria relating to your overall facial appearance, not just an individual wrinkle or a line. Sounds reasonable? So let's see. You have some wrinkles between your eyebrows, loss of volume in your mid-face, as well as your nasolabial folds. And this is how I rated your sagging, dynamic wrinkle, volume loss, and skin elasticity. Do you understand what I'm saying?
Yep.
I know that you're concerned about your skin dehydration, sagging of your cheeks, and forehead wrinkles. For hydration, injecting hyaluronic acid in small droplets into your skin will improve the quality of your skin. For the sagging, injecting hyaluronic acid, which is a natural substance of the body, will act like an inflated cushion to support facial structures and tissues that may have lost volume or elasticity. Rachel, here is your personal treatment plan. As we think about what's right for you, the appearance of your skin and the loss of volume in the mid-face area and cheeks are the key issues that need to be understood. For the first treatment, I would suggest we treat the mid-face with Restylane hyaluronic acid filler injections to address your sagging and loss of fat volume. That will also give you an overall lifting effect. For the second treatment, I would suggest we use Restylane skin boosters. It is injected into your skin to improve your skin elasticity and hydration. For the third treatment, I would suggest a treatment for reducing frown lines between your eyebrows. People will not agree with the product for its features or advantages alone. It is of course important to bring the advantages of treatments to the patient's attention, but they will not be compelled until you map them to a benefit that they are concerned about. Benefit statements, which can be physical and psychological, will put your solution in relevant terms to the patient. Do you have any questions?
Is it safe?
Restylane is approved worldwide, including by the FDA in the US, with comprehensive studies that support its safety and efficacy. The most common side effects with Restylane, as with any hyaluronic acid, are swelling, bruising and pain. Restylane has been used in more than 20 million treatments up to date. It is an easy way to stay in control of your looks without major skin invasion or effects on facial expression. Once it is injected, it will swell up with water to create a fuller, natural look. With Restylane, the result can be shown instantly, and the effects can last up to 1 year, depending on procedure and treatment area. After the doctor has completed a full face analysis and proposed some treatment solutions, the patient will meet with a consultant separately to discuss next steps and actions. The objective of the consultant is to convince the patient to commit to a treatment plan. These are some of the most commonly used closing techniques.
Let me summarize for you. The 3-step treatment plan that Dr. Willis has proposed will be completed in 3 different treatments, so each procedure will be apart from each other.
Bonus: offer extra incentives for taking action now. This works for price-sensitive patients.
The first 2 treatments cost €1,200 each. The last treatment costs €350, so that's a total of €2,750. However, I can give you a special package deal of €2,500, and if you sign up today, I can give you an extra discount of 5%. So that's option A.
Alternative of choice. This is when you give the patient 2 or more choices where both choices are a yes.
Of course, there's also option B if you'd like to stay within your budget. You can sign up for treatment 1 only, which will be €1,200. But later on, if you want to continue with treatments 2 and 3, that will cost you €2,750, losing you the €250 saving and that extra 5% discount.
Pros and cons. This technique works well with analytical patients. You can list out the pros and cons of different procedures and guide patients to make a decision based on the analysis.
Although option A is slightly more expensive, you will definitely see improvement in your skin problems.
Sense of urgency. Deadlines can provide an incentive for people to come to an agreement.
And didn't you say that your brother's wedding is not very far away? So I'd recommend signing up for treatment as soon as possible.
Assumptive close. If you have confidence that you have addressed the patient's concerns, you can act as though the patient has already decided to go ahead with the solution and get ready to move on to the next stage.
When would you like to start your first treatment? I can help you secure your booking first.
Patients might not be willing to tell you their budget directly. However, you can get some clues about their affordability from their spending history on cosmetic products, aesthetical procedures, or plastic surgeries. If you do not have any ideas about the patient's budget, you can provide 3 options. Explain to the patient the pros and cons of each plan. The patient will be able to make the decision based on the hidden budget and priority.
I would like to improve most of my skin problems, but I still think option A is too expensive.
How about this? If you sign up today, you can pay in full or buy a 12 monthly installments. Discounted payment would be €198 per month. What do you think?
Yes, that sounds much better. I would prefer to pay by installments.
Okay, great. Thanks for choosing us. Let's book your first treatment now.
If you've tried your best to close the deal, but the patient still can't decide, you can say, "I understand. You may want some more time to think about it. Shall I give you a call in a week to follow up?" Always make sure that you maintain a good long-term relationship with the patient and follow up afterwards.